The final criteria in the DSM essentially says that the symptoms are not better accounted for by a different psychological condition. How do we know if it's a different psychological condition? It's simple. Does the person meet the 5 characteristics of an obsession? Is it intrusive? Is it uncomfortable? Does it feel like we want to resist that obsession? Does it feel uncontrollable, and is it the opposite of our core values? And if so, then probably we're dealing with an obsession. The clinching deal, or the clinching part of diagnosis is, are compulsions being put into our everyday life as a result of it. So if obsessions are there and the compulsions are there, we can see a very high likelihood that OCD is present. Some of the conditions that might resemble OCD are anxiety conditions, so generalised anxiety disorder, for example. What we know is that worries, which are linked to generalised anxiety disorder, usually feel like they're a valid source of concern. We might say they're exaggerated, but we would feel that worry is being generated by ourselves, and we feel actually we have a reason to be worried. In obsessions, that would not be the case. They'd be popping into our mind. We wouldn't feel like we're creating those thoughts. And also, we would find them quite alien, quite unusual in OCD. Depression can sometimes present with symptoms that resemble OCD. So depressive ruminations are common in people with major depressive disorder, or dysthymia, or also known now as persistent depressive disorder. And that usually involves negative thinking about ourselves, about the world, about our future. We can tell that they're not obsessions by the fact that first of all, they don't have the hallmarks, those 5 hallmarks of an obsession, but also they'd be relevant to our moods. So if we're very depressed, we would think how horrible the world is. So the theme itself would be different. Another condition worth noting is obsessive compulsive personality disorder. And a lot of people who are diagnostic of it would say, I'm a bit OCD. How do we know it's not OCD? Simple, obsessions and compulsions are not there, but there are personality features in obsessive compulsive personality disorder, and they are perfectionism, orderliness, and rigidity, and those are sort of characteristics that would be affecting someone with that condition. It would also be persistent and pronounced enough to say it's getting in the way of my life, and that is different. It has a similar name, but obsessions, compulsions are not present in obsessive compulsive personality disorder. Okay. Any other conditions? There are a variety of other ones that might resemble it, even eating disorders, psychotic disorders. The simple way to know are the characteristics, the hallmarks there, are the themes of obsessions there, and are compulsions present. Final word, and certainly when we're making a diagnosis, is that comorbidity, or a coexisting psychiatric condition on top of OCD is common, is in fact the norm. Certainly above 50% of people with OCD would also have an additional psychiatric condition. The most common anxiety disorder alongside OCD is social phobia or social anxiety disorder. But depression and depression symptoms are very common also in OCD. In most cases, depression symptoms develop in response to the obsessions and compulsions it's getting in our lives. It's causing persistent distress, and for that reason we're starting to feel depressed. But sometimes it doesn't happen in that pattern. It might be just coinciding and it's nothing to do with it, or it may even pre-exist.